I'm now pleased to introduce our keynote speaker, Mr. Gus DiStefano. Gus is one of our own. He's been with the university since 2010 in the admissions office and serves as Director of Enrollment, Operations, and Analytics. But Gus is not here to speak about the admissions process or how you were admitted to USciences. He's here to speak about why you were admitted to USciences. In March of 2015, Gus, his wife Jill, and his son Augie went from having the joys of having an expanded family to the angst of every parent's worst fear, and their daughter Olivia became inexplicably sick. An explanation was elusive, and she did not get better. Fortunately, the Children's Hospital of Philadelphia, CHOP, was here to help. Gus's family benefited from the specialized treatment and interprofessional collaborative care at CHOP. He and his family witnessed firsthand how teams of healthcare providers come together to care for their sick daughter. And in that process of finding an answer and a cure, they gained an added appreciation for how the contributions of USciences graduates makes us as scientists, researchers, and healthcare professionals that can benefit all of mankind. And really, that's why you were here. Without further ado, please join me in welcoming Gus DiStefano.
Good afternoon, President Katz, Provost Miller, Dean Cunningham, Chairman Sampson, Dr. Huntington-Bresch, Dr. Farber, Alumni Association President Duffy, SGA President Falbo, faculty, students, families, and other distinguished guests. My name is Gus DiStefano, and I'm the Director of Enrollment, Operations, and Analytics here at USciences. I would also like to extend a warm welcome to our university community, to all of the students and their families here today. Over the next 10 minutes, it is my goal that my story and our short time together will motivate, inspire, and solidify your decision to attend USciences so that someday you all will make a difference in someone's life. On January 26, 2015, our beautiful, happy, and healthy daughter, Olivia, was born. Olivia completed my family. Along with my incredible wife, Jill, and my wonderful son, Augie, for the first 7 weeks of her life, we experienced no issues, other than the normal sleep deprivation which accompanies a newborn. In mid-March of 2015, Olivia started to experience persistent fevers of unknown origin. These fevers led to a visit to the emergency room and an eventual admission to the Children's Hospital of Philadelphia on March 23rd of 2015. On the day that she was admitted to the hospital, Olivia presented with severe dehydration, fever, enlarged spleen, enlarged liver, and an overall failure to thrive. Olivia received consultations and evaluations from numerous specialists representing multiple disciplines. Olivia was subjected to a battery of tests, including bone marrow biopsy, multiple MRIs which all required sedation, a muscle biopsy, and a litany of blood tests to numerous dementia. The words and acronyms being used were cancer, leukemia, primary HLH, familial HLH, and JMML, and they all started to be part of our everyday vocabulary. My wife and I spent several weeks watching Olivia's condition worsen with no diagnosis in sight. We helplessly watched our little girl, our baby, continue to suffer from high-grade fevers that always came with retching, vomiting, and severe diarrhea. Eventually, we met Dr. Edward Behrens, Chief of the Rheumatology Division. As Dr. Behrens spoke to my wife and I and discussed the possible issues affecting our daughter, Jill and I shared a look which represented the unspoken understanding and certainty that this excitable, obviously brilliant doctor was going to be our real-life superhero. From that point forward, we had the utmost confidence in Dr. Behrens and his entire team. Dr. Behrens subsequently introduced us to Dr. Scott Cannon, a pediatrician and researcher at the National Institutes of Health, who focuses on research related to macrophage activation syndrome, HLH, and related cytokine storm disorders. Previously, Dr. Cannon completed his residency at CHOP under the tutelage of Dr. Behrens. Dr. Cannon was drawn to CHOP specifically because of Dr. Behrens and the research he was doing already. After reviewing Olivia's medical records and having numerous discussions with Dr. Behrens, Dr. Cannon recommended genetic testing, more specifically exome sequencing. Exome sequencing was chosen because of its focused approach and because our Olivia was rapidly running out of time. The exome sequencing results came back in less than 10 days, a remarkable turnaround time, a product of advances in techniques and technology. We had our answer. Olivia had a rare genetic mutation of her NLRC4 protein, which was triggering formation of the inflammasome, causing autoinflammation with recurrent macrophage activation syndrome. In layman's terms, Olivia's immune system was turned on, and it did not know how to turn itself off. Her own immune system was slowly killing her. A strange feeling of relief came upon us. We knew what was happening, and now the next step was to treat it. That's when we were told Olivia is only the 5th person in the world identified with this mutation, and there's no current protocol for treatment. Aggressive treatments involving steroids, chemotherapy drugs, and trial and error with monoclonal antibody drugs were all employed. There were successes and failures, and progress was excruciatingly slow. Olivia was subjected to many side effects from the treatment she was receiving. Her nutrition, as well as all of her medications, were delivered through a central venous catheter inserted in her chest. Side effects of her treatments included extreme high blood pressure, allergic reactions, papal edema, left ventricular hypertrophy, and pseudotumor, just to name a few. All of these issues required her to spend multiple weeks in the ICU and undergo many invasive procedures. 3 months into our personal nightmare, Dr. Canna suggested to Dr. Behrens to contact a company in Switzerland, AB2 Bio, which he knew had an orphan drug in phase 2 trials in Europe that had the potential to help Olivia. Joe and I agreed it was worth the try. AB2 Bio agreed to help. Dr. Behrens petitioned the FDA for its use, and in only 3 hours received approval to use the interleukin-18 blocker from Switzerland. After 3 days of anxiously tracking the package online, it arrived, and Olivia was the first infant in the world to receive this medication. After only 4 days and 2 doses, Olivia's blood work showed dramatic improvement. The investigational drug worked. Then began Olivia's path to recovery. We continued to work with Edom from the clinical lab. We began working with Jeannie from OT and Stephanie from PT, in addition to a tremendous group of physicians, assistants, and nurses who all treated Olivia like she was their own daughter. These are just some of the people we met who contributed to getting Olivia well and home on August 6th of 2015. I stand in front of you today not as an administrator at your university, but as a grateful parent and a beneficiary of scientific advances in precision medicine and interprofessional care. As I look out into the rows and rows of our new students who have chosen USciences based on a passion for science, research, and healthcare, I have the utmost confidence that sitting amongst you are the next brilliant, humble hero like Dr. Ed Behrens, the next groundbreaking researcher like Dr. Scott Cannon, the next geneticist advancing techniques leading towards new discoveries, the next administrator at the FDA who understands and recognizes the big picture, the next scientist who creates or improves an orphan drug which can save a life, the next physician assistant providing healthcare services, the next Edom from clinical lab, the next Jeannie from occupational therapy, the next Stephanie from physical therapy, or the next pharmacist accurately calculating dosages of medicines never before used on a baby. As you begin your studies, I ask that you challenge yourself to take personal responsibility in the quality of your work, exhibit academic integrity, commit to work hard, cultivate your passion for exploration and discovery, and dedicate yourselves to becoming the next generation of doctors, scientists, therapists, pharmacists, and healthcare professionals who can save the life of the next Olivia. The specialized treatment and breakthrough discoveries which saved our daughter's life are dependent on philanthropic donations. The research of Dr. Behrens and the Division of Rheumatology can only continue to make a difference in the lives of children with your help. Please consider making a donation to CHOP or to Dr. Behrens' rheumatology research, either at www.give.chop.edu or today at our tent located outside on the walkway next to the Athletic and Recreation Center. Additionally, students, you will have the opportunity to donate through participation or attendance at our USciences Talent event, which is scheduled for January of 2017. Please feel free to visit our tent to learn more about donating to CHOP, USciences Got Talent, or just to meet Olivia, who's walking around already. Thank you for your time and attention.